Good evening, everybody. My name is Saida Alieva. I am a doctor in. I work at Ganjem Medical College. I am a surgeon, and today I want to report you about an interesting topic, which is called the bleeding. The bleeding is also very important topic, not only in surgery and also in pediatry, gynecology, therapy, first aid, and so on. And today is the third part of this topic. I would like to tell you about the intracranial bleedings. And but first of all, I would like to tell that the brain and the spinal cord are protected by three membranes, which are also called meninges, and they are dura mater, arachnoid mater, and pia mater. Their functions are the first function is the protection. They protect our brain and spinal cord from injuries and damage to brain. And also they support blood vessels that supply our brain and spinal cord, and they form together with spinal fluid. They form a cavity for our brain and spinal cord. The intracranial hemorrhages are the following: intracerebral hemorrhage, epidural hemorrhage, subdural hemorrhage, and subarachnoid hemorrhage. Epidural hemorrhage is blood collection between the skull and dura mater, which is the outermost protective membrane that encloses our brain. The cause of epidural hematoma is an artery, which gets torn by skull fracture. This an epidural hematoma is life-threatening condition which requires immediate treatment, and also it cause brain damage. It can cause brain damage and or possibly death if it left untreated. An epidural hematoma can is usually caused by head injuries, and a skull fracture occurs in 75% of the cases. And also an epidural hematoma can also develop from non-traumatic causes. They are the following: the infection, abscess, and the hemorrhage, tumors, and also the abnormal vascular connections between arteries and veins, which are called arteriovenous malformations or cavernous malformations. An epidural hematoma is diagnosed by using computed tomography or magnetic resonance imaging of the head and or spine. Epidural hematoma is a medical emergency that required and immediately medical treatment, and treatment includes the surgery and medications. The preferred surgery is craniotomy and hematoma evacuation. After surgery, the neurologist may prescribe the patients some medications to reduce inflammation and pressure within the brain. Subdural hematoma is the next type of intracranial hemorrhage. It is bleeding between the skull and the brain, but it is located just under dura mater. This area in the bleeding in this area can create the pressure on the brain, and also it can impair the brain's functions, and can be life-threatening if it isn't treated. The subdural hematoma can be caused by head injuries. If you bump your head in a fall or an accident, it is important to be assessed by a medical professional. Activities that cause in traumatic head injuries include high impact sports and car crashes. If subdural hematoma is small and the process is subacute, doctors may recommend waiting to see if it heals on its own. But if the subdural hematoma is large and bleeding quickly, it is treated with surgery. The surgeon will remove the part of the skull and drain the blood from the brain tissue, and this will reduce the pressure to the brain and swelling within the brain tissue. Subarachnoid hemorrhage is bleeding that into the area that is located between the inner layer of the tissue that encloses our brain, which is called pia mater, and the middle layer of the tissue that covers our brain, and that is called arachnoid matter. This type of bleeding is very interesting kind of hemorrhage, and this can also cause damage to the brain tissue, and it also can be life-threatening. And subarachnoid hematoma can be caused by head injuries, but this type of hemorrhage that is due to the head injuries isn't considered a stroke because it causes different symptoms, and it requires different treatment. But subarachnoid hemorrhage that is considered a stroke when it occurs spontaneous, and this it means that it doesn't from external forces such as a fall or an accident, and spontaneous hemorrhage can result from the following: The sudden rupture of an aneurysm of the artery in the brain. Aneurysms are bulges of the weakened arteries walls. Less commonly, subarachnoid hemorrhage results from the arteriovenous malformations. This is the connections, abnormal connections between the arteries and veins. And rarely a blood clot forms on an infected heart valve, travels, becoming an embol to an artery that supplies the brain. This causes the artery to become infected, and the walls of these arteries may weaken and rupture. And subarachnoid hemorrhage is a medical emergency that requires an immediate treatment. And the main goal of this treatment is to stop bleeding. And there are two main methods to stop this bleeding. The first method is to place a small clip in the blood vessel and to stop blood leaking into the brain tissue. And the second method is to use the endovascular coil. It requires making a tiny incision in the groin of the patient, and then entering the thin tube that called catheter, and then passing it from the artery of the leg up to the artery of the head that is bleeding.
Yes, okay. Very excellent. Great thanks. Great thanks. It was very excellent, your speech. No problem. Please speak us about the capillary bleeding, Maydayna.
Okay. Capillary bleeding typically happens due to injury to the skin. It's much more common than other types of bleeding.
Everything is very okay. Yeah.
Instead of spitting out us in arterial bleeding or flowing out us in venous bleeding, it oozes from damaged body part.
Yes, part.
Damages body part. Capillary bleeding is less severe and easier to control than other types of bleeding because it comes on the surface rather than inside, deep inside blood vessels.
The
body. Treatments involve a few steps. The initial step is to clean the wound with soap and water or cleanser that is non-toxic to the cells, and is put pressure under the wound with latex gloves in hand and sterile gloves. The wound may need irrigation under pressure to remove contaminants which will help prevent infection. The next step is apply the pressure on the wound with a sterile dressing or with a sterile dressing. It's very important to contact an emergency number to get medical help. If this all stops bleeding, the next step is to go around with sterile gauze dressing or bandage to continue to exert pressure on the wound. If bleeding is from the leg or arm, the limb can be kept in raised position above the level of the heart. If all efforts to stop the bleedings fail, the last result is applying tourniquet above the bleeding wound.
Yeah, both of you were perfect. Great, thanks of you, madam.
Thank you, Şefkat.
Yeah, okay, I stop the